spending 10 rupees on drug treatment programs. So how much we can save if we are emphasizing more on the prevention part of drug addiction related problem, and if we will do it very effectively with the proper participation from the youngsters like you, and obviously the talk of today is related to the fostering this belongingness, the sense of belongingness, and how we can help others to rescue from the drug addiction problem. So coming to my slide, so I will skipping some of the slides, the reason being they have already covered by the other. We have some, you can say, scientific data with us, as the recent government, the Modi government has done the second, you can say, survey, nationwide survey related to the drug problem, and the report they have made public in 2018, and it is quoted 2019 over here, and publicly and officially it is released in 2019, but the availability of report was there in 2018. So, as per the report, alcohol use in India is the one of the most, you can say, used substance in India. And if we will look into the statistics, there are 60 crore users, and out of those only 5.7 crore problem users and 2.9 crore dependents. So I will talk about the three terms which we are using. The one is use, second is abuse, and third is dependence. So in India, not only in India but everywhere in the world, so no government has the policy related to use. There are some certain drugs which are legally people can purchase and consume. So whenever you are using that, they don't have any problem. When they become addicted, then government of India and also the countries have the one strict policy. They have a zero tolerance to the substance. If someone will get dependent, so we cannot afford to let him do the drugs, and if they will try to do that, they will not be able to get out of it. So if someone is taking drug, they are not only the one particular victim of this particular thing, but the entire family is suffering. And if the problem is very vast in the community, obviously the problem will be spread over to the community, like we have witnessed the same in Punjab, as you might have already heard about. And the similar thing was happened in the northeast, particularly in the Manipur, back in 1990s, when the similar type of the Punjab problem was witnessed in the Manipur side. That was the northeastern part of the country. So if we are coming back to the again, so which is the most and very you can say favorite drug by the people, youngsters, that is the cannabis. So if you look into that is the second largest drug used by the youngsters. That is 3.1 crore users are there. Out of them, 72% lakh people are problematical users. Out of them, 25 lakh people are dependent who need treatment for the drug. So if you're looking, why we need to look into this particular statistics, that is the one is the most important part. We need to look on the population who is more vulnerable related to drugs. So in between 10 to 75 years people, there are 2.8% population is there. So males are more vulnerable to this substance as compared to females, but we cannot overcome if the females are not vulnerable at all. So till date, there are only two nationwide survey has been conducted by the Indian government after the NDPS Act. They have formed related to the control of drugs in India back in 1985. So the first ever survey was conducted back in 2004. The second survey the Modi government has conducted they commissioned in 2016, and they have made the report public in 2018. So on the basis of this report, the very important thing they have included. Now we have, on the basis of this survey report, we have the data related to the female drug dependents and drug users. So one specifically we are looking forward to go for the prevention measures. Then obviously, first of all, we need to look who is the more vulnerable particular population, and which particular area and state is more vulnerable, and how we can proceed further for the preventive programs. So until and unless we will not be aware about the magnitude of the problem, we will not be in a right situation to prepare the preventive measures and execute in the community. So these are some states who are more, you can say, suffering with the cannabinoids. The first one is Uttar Pradesh, then Punjab, Odisha, and Maharashtra is also in the list. So the third the third category of drug is opioids, and 2.3 crore users are there in India as per the survey report, and out of them 77 lakh people who are problematical users, and 28 lakh are dependent out of them. Again, once we are looking into the population, again the males are the more vulnerable gender for this particular problem, and then after the females and also the children in between 10 to 17 years old age are also again a very vulnerable population. So if you're looking for children in particular, those who are in between 10 to 17 years of age, then this number is very big. The reason being the population in India is very huge. If we will look into the highly populated nation in the world, that is China is the first and we are the second one. If you will look into the mean age, then the China's mean age is somewhere around 37 and India's mean is somewhere around 27. So there's a huge gap between the mean age of China and India. So recently the Indian government has implemented a new education policy. So we want to manage our human capital. So the first thing is the education, the second thing is the health and their psychological and physical well-being. So if we can manage our youngsters and we can channelize their energy and potential in the right direction through the proper guidance and education, then obviously this drug-related issues can be minimized in indirect manner. So if you're going a little forward, there are some certain other drugs, inhalants, which are more problematical. The more vulnerable population is the children's, and they are not that popular among the adults like in your age group. So I'm skipping few of the slides. I'm coming to the treatment part. So we have seen how many people in India are struggling with the drug-related issues in India. Out of those who need treatment for the drug, only 27 are receiving. Over here, the role of the preventive measures and awareness is very important. The first of all, people who need treatment, we need to integrate them with the right treatment facilities. That can be government and the private sector. And secondly, we need to prepare and figure it out in which particular area the problem is huge, and we can spend more on the prevention and awareness program so people can be, you can say, prevented to get into drugs. So this was the related to the alcohol dependence. The another dependence is also there, apart from the other trend, like in cannabinoids, opiates, all other drugs. Only 25% people are getting the treatment facilities. So the 75% people who want to get out of drugs but still they are not getting any treatment, that is the very serious concern for the social scientists and the government. So if you will compare the problem of India at global scenario, then obviously the cannabis use is way, you can say higher as compared to India, that is 3.9% at global level, and in India 1.2. And if we talk about the opiates, so there's a 0.70 level in the world level, and in India that is a huge problem, which is again a very serious concern. So I will let you know why it is serious related to the cocaine use and opiates and ATS. We are going little forward. So there are three things which we need to be very particular about: the recreational use, drug misuse and abuse. So recreational people might be looking forward to feel good, and they might recreational, once we are talking about the recreational use, so people start with the recreational use, they want to get high on drugs, and their motive is not more on the instrumental use. And if we are looking into the population who are working, definitely they might look for the instrumental juice as compared to the youngsters, those who are looking